Well, thank you very much. I'm real enthusiastic to talk to this group about this topic today. And just by a show of hands, how many people in here work with families? Just everybody, anybody in here have any struggles with getting dads involved or want them involved some more? If you put your hand down for that, I want to talk to you later because I'd like to know your secret. I got interested in working with fathers. I worked in Dr. Palm's summer treatment program for 7 years, and one of the things that happened as I went along is I got more involved in the parenting part of the program. I got to lead some of the parenting group meetings, and as I did that, I was trained to be a good scientist practitioner, and I was observing what was going on. And my first year of doing the parenting programs, I noticed something that for the first couple of meetings, we would have couples show up, or sometimes just a dad. And as the weeks went on, those dads disappeared, and they didn't show up as often. I filed that away. I thought, boy, that's kind of interesting. And then the next year, I was kind of in tune to that. And Monday nights were the parenting night, and that was the night that the parents would come in. There would be departures at 5 o'clock. And I would be out on the field with the kids, and they would be playing softball, or maybe they'd be playing soccer or basketball or something like that. I would notice on Mondays, we'd have a lot more dads at departures than usual, and they'd come early, and they would line up along the edge of the field, and they'd start commiserating about the kids. They'd talk to one another. They would receive the kid at departures. They'd get in their car and drive home, and oftentimes another car would drive up with the mom, and they would walk up to the parenting meeting. And then as the leader of the parenting group, I knew that most of what we talked about were complaints from the mothers about the dad and the kid. And I thought, oh, well, we're missing something here. And so I became interested in this topic and started to look into it a little bit more. And so what I'll talk about at the beginning today are some things we know from the developmental literature about the roles of fathers in families. We'll talk a little bit about some of the barriers or difficulties of getting dads involved in programs, or especially clinical interventions. There's some really good work that's already out there that I'm going to try to review. And I'll tell you a little bit about an approach that myself and my colleagues have been piloting and working on, and has been at the beginning successful in getting dads involved in these kinds of programs. So I should have one qualifier right at the beginning here. I'm going to use the term dads or fathers throughout the talk. I'm using that term as broadly as possible. So that might mean biological fathers, stepfathers, grandfathers, uncles, mother's boyfriends or partners. This term should be construed as very broad in the talk. And we know we have lots of examples of good fathers, right? We can think readily of some good examples. You can probably fill in your own favorite TV shows. We also have some bad examples of dads that we know about, right? And so we're thinking about parenting on a continuum here, right? And fatherhood is on a continuum. And so the first thing to think about is, what do dads do? And there's really nice papers. This is a nice review. There's some more recent reviews that have just come out that look at the role of fathers within families. And the role of fathers is multidimensional. So you can think about breadwinning or provision of resources. Fathers can be involved, and involvement's a broad construct, right? So you can think about involvement as direct engagement with the child. But there's also involvement like, if a child's sick at school, is there another person or another parent that can be called to pick up that child if one parent's busy, right? That's a kind of involvement to think about too. That's a resource. Fathers have responsibility for kids. They're involved in parenting. I'm going to come back to this later. They're involved in co-parenting along with a partner. And I should be honest, I always feel guilty when I look at this slide. My son in preschool had a little task where he was supposed to talk about what he does with his parents, and so he brought it home. It was really nice. He had it for, this is what I do with my mom. I make snowmen. She takes me to the swimming pool. She fixes my boo-boos. She tucks me in at night. She reads to me, and on and on and on and on. And so, boy, that's really cute. He really loves you. That's really nice. And I flipped it over, and I had my dad and I eat chips and watch the football game on Sunday. Okay. So I'm continually working on moving towards the middle of the continuum here. And here's a little slide that talks a little bit about one way we could think about parenthood. I'll give you a second to read it. think the point that Calvin and Hobbes is a nice cartoon to think about, because when you do think about it, there aren't any roadmaps or guidelines for parents. So the parents are talking about the difficulties of parenting, and the punchline is, I didn't think I'd have been in such a hurry to reach adulthood if I'd known the whole thing was going to be ad-libbed. And I think as clinicians or providers, that's something we can really do to support the families we work with, is to help them down the road by providing some supports and help for them as they deal with common developmental problems or more serious ones in clinical settings. So there are some things that fathers don't do, and here's a place I'm going to be painting with a broad brush. So there's certainly exceptions to these rules, but if you look across lots of studies, here are some places you don't see dads. Children don't often interface with the child's teacher at school, so it's not a typical role. And Jason Downer's done some nice reviews from the child developmental and school-based literature. It shows they're not often engaged in school-based functions. As I'm getting grayer, I'm learning that. Part of my role is to go out to schools often and consult with teachers and interface with them. And oftentimes they'll say, oh, you must be Timmy's dad, right? And that tells me something, right? That tells me I've never been introduced to the child's father before. Fathers are also not, if you look at the demography of what fathers do across the literature of roles in families, they are rarely the top person in a family for any child caretaking tasks, dealing with the doctor, getting self-care tasks for the kids, preparing meals, all of those sorts of things. They're engaged in those things and they're involved, but they're not often the boss of those things. That's an important thing to think about when we turn to interventions for fathers. We also know that fathers are less likely to get involved in mental health interventions or in clinical trials or studies. So if you look at the N's for moms versus dads in a lot of parenting studies, a lot of times the N of dads that are participating in the studies is half that of moms, or maybe even less. Sometimes studies are just moms. However, fathers have an incredible influence on kids' development. So Park and his colleagues have come out with some nice studies that show if you look at social development of children, this is a place where fathers do have a clear role. This is a niche for them. They're involved in helping kids, and there's a couple of studies that came out a couple years ago are kind of interesting. It talked about how rough and tumble play can help teach little kids, toddlers, how to deal with peer interactions that they're going to be confronted with a little bit later. It helps them set limits, know when they've gone too far, how to interact with someone in a social relationship. Fathers can help kids with focused attention. And so when we think about interventions for kids with ADHD or disruptive behavior disorders or other disorders, and we're interested in engaging fathers, this is something to remember, that the social interactions that those kids have might be a place where the father has a role or a place where they're going to be able to support children. We know also that if dads are positively involved with their child, mothers report reduced problems in children's behavior. So just having the dad positively involved can offset some of the overall family stress. Although I said fathers aren't involved necessarily in direct school interactions with teachers or other professionals in the building, if fathers are positively involved, kids have stronger senses of their academic competence. They produce more in school and achieve better. And a number of researchers have found this finding across different samples and different age groups. So that's someplace where it does seem if fathers are involved, they're going to help kids with their academics and school success. Although this is it's a secondary study and retrospective, it's kind of interesting. McCord looked at families from 50 years ago and looked to see whether the mom and dad got along. 50 years later, when they followed those kids up, the families that had the healthiest families were the ones that turned out the best. And there's a couple of other studies that have shown that if the father's involved in the family life in a positive way, children's social adaptation turns out better. So a lot of those studies come from typical child development. What I'd like to do now is talk a little bit about how fathers might be even more important in clinical samples. So we know that fathers are involved in discipline and parenting. It's no mistake that there's that old line, wait till your father comes home, right? Fathers have been involved in discipline in families for a long time. We know that if moms and dads are on the same page, that can promote better functioning within families, especially with kids who have challenging behaviors. Right? When you think about typically developing kids, if you're a mom or a dad and you make some mistakes in your parenting along the way, and you're not dealing with a whole lot of misbehavior, that's not going to accrue as much of a deficit or a problem over time. We saw a nice talk by Dr. Deshawn earlier this morning, however, that talks about this coercive family process. If kids are exhibiting challenging behaviors frequently and you're making lots of mistakes as a parent, it doesn't take long for things to go south. I should also mention, if we think about clinical samples, there's a couple of nice studies that have focused on dad involvement. One by Dan Bagner, I think he may be here, and also one by Carolyn Webster Stratton a long time ago that showed if you're doing parent training interventions, families that have moms and dads participating together and working together have better maintenance over time. So those families perhaps learn more within the context of the parenting program, but they're also able to apply those strategies and skills more effectively as they turn into a maintenance or generalization phase of the treatment. If we are going to talk about dad involvement, however, and I'm going to spend the rest of this talk talking about ways to engage and involve fathers, it's probably wise to talk about situations where father involvement may not be the best. So we know that fathers are frequent flyers within maltreatment cases, right? 40% of maltreatment cases include fathers. Even more striking is that when you think about the more severe forms of maltreatment, cases where children are ending up in emergency rooms or being hurt really bad, fathers are overrepresented in those sorts of cases. So it's not wise to just, with a broad stroke, say we need more father involvement. All clinicians need to think about these things before working hard to engage fathers. It's also the case that parents, fathers who have their own psychopathology, specifically antisocial type behaviors, actually end up with having children have worse outcomes than if that father wasn't even involved in the home in the first place. So for some families, the best clinical solution may be to have less father involvement rather than more father involvement if you have these kinds of contextual factors at work. So I'm going to shift gears a little bit. This is a conference on evidence-based treatments for children, and there's clear evidence that behavioral parent training, teaching parents how to manipulate antecedents of negative behavior, how to set rules and limits, how to provide clear expectations for their children, how to give good instructions or commands that are likely to result in compliance, and teaching parents how to set consequences that are clear, how to use frequent rewards or attend to positive behavior, how to punish prudently. All of those things are best practices for kids with disruptive behavior disorders. The settings where those sorts of interventions work are in the home, and that's where a lot of the studies have focused. There are some studies that show that these sorts of contingency management or parenting approaches can help with school behavior. And then also, and as I'll focus on at the end today, recreational or peer group settings are another location where you might think about integrating these sorts of parenting programs. And as you can see, across a number of disorders, there's a number of studies that include parent involvement and have shown positive outcomes for children who have been involved in such programs. My colleague, David DeGarmo, actually has a very nice program of work where he's been looking at parenting programs for stepfathers in families and shown nice maintenance of effects over a long period of time. I spotlight him because he's one person that has really focused very carefully on inclusion of fathers and measurement of fathers in parenting programs and studies of them. However, even though there's a very clear evidence base that these programs work, and controlled randomized trials have shown that families that get the intervention perform better at post-treatment than families that get some sort of control, there are barriers to the clinical application of these interventions in the field. One thing that we know is that, and again to go back to the talk, if you build it, they may not come. We know that if you set up a behavioral parent training program and you expect people to just show up and get their parenting fix, that doesn't happen. Have people had that experience in their work? Engagement is a big issue. So just because you have a great model of intervention doesn't mean that people are going to receive it and benefit from it. In fact, if you look at outcome studies that have dealt with high-risk clinical samples, rates of dropout or non-engagement are extremely high. They are up to 87%. They may be even higher. In some of my naivete early in this work, I tried to set up a school-based program for dads, and I think I beat the N of 1 earlier today. I had an N of 0. I had nobody show up, and it was an early morning, but an easy morning. We got out of there quick. that's a lesson, right? That teaches us that our interventions need to be developed in a way that are engaging, enticing, and can help people continue with them or persist with them over long periods of time. So I was really fortunate to be in a lab at a time where a lot of folks were interested in taking these best practice parent training approaches and adapting them for particular groups of individuals who may not be turning out to receive the intervention. So Andrea Cronus-Toscano had a very interesting application of parent training where she infused the Coping with Depression course to help mothers who had stress or depression related impairments. My colleague Anil Chaco worked with single mothers who had high-risk situations due to poverty or high stress or low social support. And I started focusing on fathers. I thought that was a group that we could start to think about adapting our parenting strategies to help support them in their role within families. And so the first thing I did is I went to the treatment literature and looked to see what had been done in terms of parenting programs for fathers. And the first thing that I found was what I mentioned just a few moments ago. Behavioral parent training was a well-established treatment for ADHD. It was a well-established treatment for comorbid disruptive behavior disorders. There were components of behavioral training in many of the other interventions that were talked about as well-established for children. But when I started flipping through the methods section of those journals, almost none of them specifically dealt with fathers. And when I dug a little deeper, only a few had actually analyzed outcomes from fathers. And over half of the studies in the entire ADHD literature, behavioral parent training, made no mention of father involvement or explicitly said what happened. Some of them excluded dads, and the reason was they were too hard to get involved in the trial. So as I started to read all of these articles, I thought, boy, this is really a missed opportunity here for researchers and clinicians if we're not thinking about dads in these families. One way to conceptualize this, people talk about disruptive innovations. If we could get more dads involved in parenting programs, we'd increase the number of parents receiving this intervention by 50%, right? We'd double the number of parents that were getting these interventions if it's mostly mothers in a lot of these trials. Then, instead of just looking at ADHD, we looked across the whole field. Cheryl McNeil has a nice review where she did a very similar thing with children who had oppositional defiant disorder or conduct disorder, and she had almost the same conclusion, that in all of those studies, and it's an even bigger literature, there was very little accounting of father outcomes or father effects in behavioral parent training. Further, some of the studies that had studied dads yielded equivocal findings. So if you look at an early study by Martin, he said fathers didn't benefit at all from behavioral parent training. But if you read the study closely, in that study the fathers were just observers to all the practice throughout the parent training and did not get actually involved in what was happening in an intervention. Maybe it's not surprising that they didn't get any better. If you looked at other studies, though, people did report some merit to involving dads. They got better in terms of their parenting skills, they were reporting better child outcomes, and they're reporting better interactions with their partner. So I will spotlight a couple of really nice examples that have focused on fathers in parent training. So this is from Sheila Iberg's group. This is a PCIT trial where they randomly assigned a number of families to either PCIT or a wait list. I should note, even though the N of 12 in each of the groups is not bad, given that there's not a lot of fathers represented in the whole literature, it's only about half of the total number of families that were involved in the big trial had a father that also participated. So this is a smaller group, and all of these findings are qualified by that, right? So families that have a father show up for a trial and participate may be different than the sorts of families that don't have a father show up or participate, either because the father is not in the picture at all, or thinks the mom's all wet with her idea that this kid has behavior problems, or maybe that they don't believe in that psychobabble or whatever it might be that is going on. But if you look at the parenting behavior, now this is the proximal outcome of behavioral parent training, right? We hope downstream we fix the kid's behavior, but the first thing we hope to do in a behavioral parent training intervention is get the parents to parent in a more consistent and effective way. And just like lots of PCIT studies, the effects are remarkable. So look at the rates of praise between the waitlist and the PCIT group at end of intervention. You get 20 praises versus only 2, right? If you think about that kid's lifetime, if you have a dad who's praising his kid 20 times per day, or 20, this is probably about a half hour, 20 times per half hour versus one that's praising only twice per day, over a week, over a month, over a year, over a decade, over 2 decades, imagine the different upbringing that child's going to have relative to the one that's getting just standard of care, which is not much. You can also see that criticism reduces at post-treatment. So now we have a ratio, right? We have the dads that got PCIT praising their kids more and criticizing less. That's even better, right, if we think about that lifetime of interactions. And the dads in PCIT, as they were trained to do, are describing behavior better. They're having more non-demanding interactions with the child that are non-threatening and perhaps fostering an interparental or child-parent communication that may be really helpful in terms of language development or building a good relationship for the long run. A different group, Carolyn Webster Stratton's group, also looked at mothers and fathers in an intervention. This is a much bigger sample. Now we're talking about 70 dads that went through her trial. If you look at moms and dads' outcomes, you can see that the mother outcomes and dad outcomes somewhat mirror each other. This is negative discipline strategies. So this is using more coercive processes with the child. You can see moms and dads both have high rates of this at pre-treatment, probably how they got in the trial to begin with. They reduce very well at the end of treatment. And then moms and dads generally maintain those reductions 1 year out. So they learn these skills, they apply the skills, and they're continuing to use the skills according to these data. These are nice outcomes. If you ever want to be humble, you should read the literature of the Triple P and Matt Sanders, because every time you think you have a great idea, you find out that the Triple P group already did it. And thinking about doing a meta-analysis of father outcomes, well, they have so many Triple P studies that they could do a meta-analysis of all the Triple P studies that have been done, and many of them had mother and father outcomes collected. And they yielded an interesting finding from their meta-analysis. They showed an overall impact of the Triple P parent training studies. The effect size was 0.8. We heard yesterday that that's considered a large effect size in studies, right? This is really moving the needle. Parents are really improving in their parenting following engagement in these interventions. Mothers' outcomes, if you focused on just mothers, mirrored the overall effect. If you look at the effect of fathers, it's not bad, right? But this is approaching more of a medium effect, right? It's not moving the needle quite as much as the outcomes related to mothers, which is kind of interesting. If you lumped the moms and dads all together, the reason why the overall effect isn't a little bit lower is because there are fewer fathers in many of the studies providing outcomes relative to the mothers that were engaged. So that's kind of interesting. The results of parenting programs as traditionally employed for dads seem to be somewhat attenuated relative to what you get when you look at the outcomes for moms. I was really interested in this outcome. So they looked at attrition within the studies. If you look at whether or not people drop out from parent training programs, you get a remarkable difference in the size of the range. So most of these studies weren't geared for this exact question, so all they could present was a range. But only up to a quarter of mothers will drop out of parent training programs. That's actually pretty good, right? Because I told you up to 87% will drop out of parenting programs in other studies. The range for dads, though, goes from 0 to 100. So there were some studies in the Triple P parent training literature where no dads persisted with treatment. They all dropped out. And another interesting outcome was that when you looked at the self-directed Triple P, so they have a format where parents can walk through a self-guided parent training program, and they have data that show that's an effective approach for parents. That only worked for moms. Dads didn't do as well with persisting with a self-guided approach where they were in charge of their own training and it was left up to them to figure this out. It's kind of interesting. We'll return to that point later. So if I were to summarize the literature on fathers in behavioral parent training programs, there's only been a very small number of studies that have addressed the role of fathers explicitly and specifically. Some of the studies that result in these equivocal findings have methodological limitations or there's discrepant findings in the literature, so we are a little bit adrift in knowing exactly how important it is to include fathers in parent training programs. And it's been a very few number of studies that have looked at the outcomes for fathers. Many of the method sections, if you read the literature, will talk about fathers being involved or how many fathers were there, but then the table that shows all the outcome pre-post follow-up are just mother ratings. And so that's a limitation of our knowledge base as well. So I've outlined that dads aren't often involved in these studies. It's probably worth spending a couple of minutes talking about why they might not be involved in these investigations. Part of it might be the way we as providers deal with fathers within the realm of clinical interventions. So I had this experience when I first started. I was working as a research assistant. I was in charge of doing phone screens with families that were supposed to be in clinical trials. And this is back when you had rotary phones. I would dial the number, and I would call up and I'd say, "Hi, can I speak to Mr. or Mrs. so-and-so?" And every once in a while I get the dad on the phone. And I'd say, "Hi, I'm Greg. I'm calling to ask a few questions. What's your name?" I get that down. I'd say, "Okay, and what's your child's name?" I get that down. I'd say, "What's his date of birth?" And I get a pause. And I'd say, "Okay, where's he go to school?" Okay, I got that. What grade is he in? Oh, let me get my wife. And that's the way 3 or 4 of the calls went. And so I learned pretty quickly, my job was to get through this big stack of phone screens. I just started asking for Mrs. So-and-so, and I marginalized the father right away because that was an ineffective or inefficient approach. I run into this a lot in my work. Most of the rating scales that are out in the literature are normed on only mothers. So when we think about looking at the clinical significance of our findings or normalization of functioning, if we only have mother norms, we can't do that in our investigations. And so that's a problem. And it's also why when I still do it when we do clinical trials with kids, I say make sure you get the mother ratings. We'd like to get the dad, but we definitely want to get the mothers because we want to be able to interpret our results when the trial's done. And then we also know that standard clinical hours are not going to cut it for any family who works a day job. It's hard enough to get up and get to work and deal with the sick days you have. You can't be taking off 1 day a week to meet with a clinician and get all the way across town in order to do that. So the way we offer treatments are often not the best or sensitive to the situation most families have. So those are some problems with our services. There also may be some parameters within families that impact the lack of father participation. So we know parents of children with ADHD have an increased likelihood of having ADHD themselves. We also know that if you have ADHD and you're a mother, that impedes parenting. There's a number of studies that looked at that. We actually, I think Dr. Bickman is here. We've liked his caregiver strain questionnaire, and we've used that in a lot of our studies. We have a paper that is under review right now where we did a multi-level analysis of having a kid with ADHD and then having parents, co-parents, and looking at gender by whether or not the parent had ADHD or not. And what we found was something that we weren't too surprised by. If a mother had ADHD, they were more strained in all of those domains. Their life was harder, and they had more negative emotions related to their child, and they had more trouble with having to go to the school and trouble with the neighbors and things like that. If the dad had ADHD, though, they didn't seem to care. It didn't matter much relative to if they didn't. And I think that goes back to what dads do, right? If you look at the items on that rating form, it has to do with a lot of things extra that you have to do as a parent. And if the mother's already in charge of a lot of caretaking and you have a kid with ADHD, they're going to have to do a lot more caretaking and a lot more work with families. And maybe the fathers aren't really involved in much of any of that at all anyway, so they're not feeling any strain. But that doesn't mean there's not some strain other places, like, for example, in their marriage, right? So that's a reason why you might want to think about dads in your interventions as well. Another reason why parental psychopathology is an important thing to think about is that if you have a parent who did have ADHD, say it's a dad, or maybe had some learning problems, or school was a hard place for this parent, they may have presuppositions about what's going to happen in your intervention that aren't necessarily accurate. And I give you one example of a parent I was working with in a school, and we were talking about this child getting special education services. Well, now I know about inclusive practices. I know that a consultant teacher would come in and support the gen ed teacher. This would be a student beginning a daily report card, a positive program. And we were working with the mom, and she was on board with this, and the teachers all thought this was a good idea. And at the 11th hour, I got a call from the school psychologist saying we have to have a meeting that the family has changed their mind about special education. And I went to the meeting, And there was the mom and dad sitting there. And this was the mom that we just had this agreement with, so I'm wondering what happened here. Well, the dad heard the word special education, and in his mind, special education meant a trailer on the back of the lot in the school where you went and were restricted from being in the building with everybody else, and there was a crude or rude nickname about the students that had to go to that trailer for their education, and he was one of those students. And so not having him involved from the get-go, we eventually resolved it, but it threw a wrench in the whole works of this child's plan for a while. And had we not had a school psychologist who was invested enough to sit down and talk this out and deal with it and problem solve, this might have been a kid that didn't get services that he could benefit from. Likewise, if the parent has ADHD, putting them in a 2-hour classroom-based program may not be the best approach, right? It may be hard for people this morning to persist in their attention for an hour, and you don't have attention problems, presumably. So the format that we use for parenting programs may not be the best. I asked Dad after, as I was thinking about modifying our parent training approach for dads, what they thought about our parenting program, and he said, you know, it's just a bunch of ladies nattering on. Okay, that's one perspective. But when you think about what we did in these groups, it was problem solving, it was talking about examples, and it was dealing with things that may not have been as relevant to the dads as it was to the parents doing the direct caretaking. So I already mentioned dads don't have primary responsibility for any child care tasks, but that doesn't mean they don't have primary responsibility in other areas. So when we think about recreational activities, unstructured play, dealing with yard work or going to the store, doing things like that, if you look at the demography of fathers, now you see the fathers float up towards the top. This is their domain. It's things that they're doing. So that might mean our typical content in behavioral parent training classes, where we're getting the kid ready for school, getting them ready for bed, bathing them, feeding them. Some fathers do that, but all of them may not. And I had a rude awakening on this. When we first piloted our Fathers Only program, I had been doing parent training for some time, and I said, well, let's talk about a typical situation where you might have to use good commands or instructions for kids. Let's take getting ready for school in the morning. Crickets. Everybody just stared at me. I said, well, what kinds of instructions do you give in the morning? Crickets. Nothing. I said, does anybody? Nobody. We had 12 dads sitting in front of us, and not one of them had that role within their family. This slide is just for the gentlemen in the room. All the ladies can do something else. This is some advice, and I only learned this after I got married. If you're driving around and you're not sure where you're going or you get lost, if you go into one of these buildings, someone will give you directions to help you get to where you're supposed to go. Men don't like to ask for help, right? If you look broadly, not just in the behavioral parent training literature, if you look at treatment for depression or anxiety, physician visits, preventive services for medical or psychological problems, you don't see men engaging in those services at high rates at all. There's a real nice review from the American Psychologist that goes across a number of different sectors and shows that. We learned this lesson when we were recruiting for our first study of fathers. I had often had success with advertising on the radio for our parenting programs. And I thought, oh, well, men listen to sports radio. I'll advertise on the sports radio station. And so we did that for a little while. And we had trickling in of recruitment calls. And so we did what we often do. We did a focus group. We got some dads in and we asked them about this. And we said, we should have done this first. We said, well, we're having a hard time with recruitment. We're not getting very good sign up in our program. And here's what we're doing. And they said, well, why would you be advertising on the men's stations? The Saturday activities for our kids is what the mother plans, and then we just go where they tell us to go. And so I thought, oh, that didn't occur to me. So we started advertising on a radio station with a primarily women's demographic, and the next day we had 80 calls, and we had lots of sign-ups. So we learned something with that focus group. I'm indebted to those gentlemen for helping us. Part of the reason why dads might not be calling for behavioral parent training programs is that even in the face of parenting problems, so if you observe them and see that they're having parenting problems, or if you give them rating scales and they're endorsing dysfunctional parenting strategies, unlike mothers who are more realistic in their appraisal of the state of their parenting, fathers paint a very rosy picture. So even though they're not doing things that are great, if you look at studies that ask parents about their parenting and their fathers, they'll say things are going pretty okay. Now, if you get a collateral rating from the mother or the child, you might have a different picture. But it's not surprising then that dads aren't going to be jumping up and down to join a parenting program if, in fact, they don't think they have a problem. So those are some reasons why fathers might not be involved, and maybe that's an okay state of affairs. It's been the state in our field for decades now, but there are some reasons why you might think father participation needs to be improved. Here's a picture's worth 1,000 words. I took this on my way out the door to Miami. This is a picture from my house. Of course, I'm going to Miami, and this is Buffalo, New York. Here's another idea. Even when fathers might want to be more involved, may not be well received from a mother who has a pretty good system in place. It's another caution, right? More involvement's not necessarily better. That involvement needs to be systematic and thoughtful and helpful to the family unit. So one thing we think about really carefully in our work is the agreement on discipline strategies. Having a father go in there and taking charge and all of a sudden having all these great ideas with a parent who's been parenting this child for 8 or 9 or 12 years may not go over so well. When mothers disagree with fathers on their approach to parenting, they actually don't want them involved very much. So that's something we want to think about in our interventions. I'll just mention one other study and something to think about in some of these outcome studies. Jeff Danforth did a very nice study where he had moms and dads involved in a parent training program. It was a typical parent training program for kids with oppositional defiant disorder and ADHD. And at the end of the intervention, they had the parents fill out rating scales on how well their parenting improved. And moms and dads both showed great improvement. They did something else that was kind of inventive. They had parents wear a voice-activated recorder around their neck and recorded them interacting with the child for half an hour in the evening. And mom showed improvement on that measure as well. They gave more good instructions, they were more positive, less negative. The father's outcomes were flat. They didn't improve at all. So even though they told the researchers that things got better, when you looked at an objective indicator of their parenting practices, it didn't improve, unlike moms. And Danforth's parent training approach was a traditional classroom-based model. We also know that moms and dads might think about parenting differently. This is a conversation I have with parents over and over again. I think there's an idea when they come in and meet with me that I'm expecting them to both agree 100% on the child's behavior and their approach to parenting. In fact, it's normative that parents disagree. They have different roles or responsibilities. They see the child in different contexts, and because of that, they're going to have a different perspective. Fathers may think about treatment differently than mothers. So Chuck Cunningham's done some terrific work where he's integrated marketing research into asking parents what they want in clinical interventions and making them make a series of trade-offs. So what bubbles to the top are the things that are most important to individuals. And not only the entire population of individuals, you can look at different segments of that population and see if there's differences in preferences. And one thing, Dan Washbush just had a study that showed that dads may be less enthusiastic about medication interventions for kids with ADHD. Well, that's good news for those of us that do parent training. Maybe we have a viable alternative for them. However, if you look at a different survey, fathers were less interested in participating in active intervention. They were more interested in getting information and maybe feeling things out at a much slower pace than moms. And this maybe is representative of what happens with dads. If this is a dad that's working or maybe not primarily involved in child caretaking tasks, but looking forward to a vacation, here he is, and he's saying, boy, that car ride with Kelvin was terrible. How many people have been on a long car ride with an 8-year-old, right? It's not fun. Whoever invented that DVD player for cars, I want to shake his or her hand. He's got these great expectations for the vacation. This is a great place. The first comment from the kids, I'm bored, when are we leaving? And so here's a father that may have a hard time this whole week in a different role with the child. Those recreational or unstructured settings, though, are very important to think about because fathers are primarily responsible for their child in those kinds of settings. We also know that children with ADHD have a hard time in structured settings like little leagues or sports activities or other community activities. In fact, a lot of the kids we work with, and presumably this is one reason why Dr. Palom's summer program is so successful for the kids, is those kids' behavior is so difficult to manage that when they sign up for t-ball or youth soccer, they have such a hard time, and their parents are standing there on the sidelines watching their child have a hard time relative to the 10 or 12 or 20 other kids, that they stop participation. And by the time they're 8 or 9 or 10 or 12 years old, they don't have the skills or knowledge of rules or other things that the other kids have been able to experience as they grow up. So we think that there's two opportunities here. One is an opportunity to engage fathers in a place where they're used to working with their child. The other one is a chance to build competencies for children that may need them. Certainly, dads may also need some help in these situations as well. This is a public health initiative in Toronto because of problems with adult behavior during youth hockey games. I know people remember this case that happened some years back now where two fathers, one was a coach, one was a referee at a youth hockey game, and the coach punched the referee, fell backwards in his head, he died. And all their children were standing around them, right? So this is an extreme example, but think about that sort of situation unfolding on a minor level at little leagues all across the country. If you read this case closely, the referee had a long-standing history of psychiatric externalizing type problems, as did the kids that were involved. So it's not too far to say that this is like a family we might see coming into our clinics or our school resource centers. So the next question is, what can we do to increase participation in our clinical programs? And we thought long and hard and stayed up late at night and scratched our heads a lot, and people that had beards were scratching their beards, and we came up with a solution that was probably the right one. You just give them free beer. I showed this slide. I need to track this down. Somebody had told me, this is another reason to be humble about Triple P's work. Somebody told me that an idea that the Triple P had was to do their Triple P positive parenting programming for fathers on the bus on the way to the pub to watch the soccer matches. Go where they are, right? It turns out this is a bad idea, so we discounted it. Dr. Palom has done some work that shows that parents dealing with difficult to manage kids that are drinking alcohol have more hostile thoughts and more depressed symptoms. So what we did was something else. We looked at the literature, and I was really fortunate to be in a place where I was interacting with Dr. Palom and Dr. Cunningham, and I knew that they had two best practiced interventions. And that's what we came up. We came up with this Coaching Our Acting Out Children, Heightening Essential Skills program. It's a 2-hour program you hold once a week for about 8 weeks. And it's 8 weeks because that's the typical range of time Little League programs run for, and then they reset. The coaches program integrates interventions from these two manualized best practice procedures. So the summer treatment program's been around for a long time and has developed really tight procedures for teaching kids sports skills, teaching them how to behave in sports games, teaching staff how to support children in developing their sports competencies. And the COPE program is a terrific program. It's a large group program where parents meet in subgroups. They look at parenting situations. It teaches them to identify errors. It teaches them to come up with their own solutions for how to deal with those errors. And it teaches them to try out those strategies with their kids during the week. And anybody that doesn't know about these two programs should. They're terrific interventions for kids. We, with the guidance of these individuals, we tried to combine them together into a program specifically for dads. And so for the first hour, the dads meet with other dads. We thought that that was important as we were developing this intervention. I kept thinking about that guy that complained about the mothers talking too much about their things. I thought, well, I want to make sure the conversation only relates to things dads want to talk about. They also meet in a group, and they learn strategies like how to use praise, how to use time up. We'll use the COPE model. So this is not an instructor standing up in front of them telling them what they're supposed to be doing in terms of their parenting. These are parents that are generating their own solutions to parenting, which we thought was particularly good for dads who might not like an intervention that's blaming them about something that's central to their role. You know, you're not a good father or a good parent. At the same time, while the dads are in this meeting, the kids are learning soccer skills. They're learning how to dribble, shoot, pass. They're learning the rules of the game. We chose soccer not arbitrarily. We like soccer because anybody can do it. So if we were playing baseball, we were afraid we'd have kids that were swinging and missing for the whole hour, right? Soccer, as long as you can move your feet, you can kick a ball. It also spreads out the kids, which we like when we have kids who have some problems with aggression, to put some space between them. And it also permitted space for the dads to get on the field if they wanted to and work really carefully with their kids during the context of the game. This is a pretty standard syllabus for a parenting program. After that first hour is over, we have the fathers join the children for a soccer game. And so during this game, the fathers are told that they're going to coach the game. They're in charge of parenting and coaching. And they have little assignments each game. So we give them a little card. And when we talk about catching your kid being good, we say you need to give 5 labeled praises to your child during the first quarter of the game. And their job is to tick off every time they say, I like the way you're a good sport, or I appreciate the way you're facing the right way on the field today, or those sorts of things. We catch the kids where they're at and shape them up. During frequent breaks throughout the game, after each quarter, we have a little subgroup meeting. So we get the dads to all come together, kids go off and get a water break, and we do a real quick check-in with them, and we use peer feedback. So we ask them to tell each other something that they liked that they saw during the game. Would anybody like some advice about what's happening? And the dads are readily able to do that, and they do it very quickly. And then they have an assignment for the next quarter. So it might be to give label praise again, or if somebody had a hard time, we might tell them to focus on something more specific. This program is different, though, than some other parenting programs. So we don't approach fathers as deficient in parenting strategies. We're approaching them as coaches for their kids. We're meeting them in a setting where they may be more comfortable than in a clinic where we're talking to them. It also frames treatment as a way to build competencies rather than talks about parenting problems. And when we piloted this the first time, I learned this lesson immediately. We had a dad working with his kid, and his kid climbed up on the goal, and he was standing up on it, and it looked kind of dangerous. And I went over to the dad, and I said, you should tell him right now to get down from there. And he told me to shut the front door. It was cold out. And so I did what I probably should have done. I modeled compliance, and I backed off, and I made a little note. Direct feedback might not always be the best in all these situations. That taught a lesson, though, right? That a more aggressive or assertive approach may not be meeting these dads where they're at. They might need to be brought along a little more carefully. We also know that dads liked the sports, right? I told you about those dads lining the sidelines of the end of the day at the summer treatment program. If you go to Little Leagues across America, you're going to see parents at those events. People like to watch their children in these events, so we thought this might be a naturally reinforcing part of our intervention that really would bring parents back. And we also know that practicing parenting strategies might be particularly important for fathers. The folks that do PCIT have known this for a long time, that practice really helps. Dads in particular might like that applied practice. So in the last little bit here, I'm just going to tell you a little bit about the outcomes of our program. Anybody that comes to the workshop this afternoon will practice some of these strategies and try them out. We did a waitlist controlled trial. These are all children with ADHD. And I hope you don't mind if I skip ahead a little bit here to the results. On the DPICS, a measure of parental praise, we got a significant effect. We got a moderate effect of our intervention, that dads praise their kids more often. They're more likely to catch their kids being good in our structured interaction that we recorded, relative to the waitlist group, which you can see didn't improve at all. They stayed stable. Negative talk went down too. We had a little bit of a wonky outcome here, but again, the waitlist group didn't change at all. We had fathers in the coaches group end up significantly decreasing their negative talk, almost in half. And then if we looked at the ECBE, an outcome of child behavior problems in the home setting, fathers in the coaches group reduced their rates of rating the intensity of problems. Now we're working with an ADHD sample. This is a chronic disorder where you'd expect these problems to persist for a long time. We didn't make all the problems go away, but what we did do is the father said these problems aren't as bad. The intensity of the problems reduced. We also, I should acknowledge, we had some outcomes that did not have significant findings. So the fathers didn't get any better in their use of commands. I mentioned that they didn't change their problem ratings. Something we learned in this study is that untreated mothers had smaller effect sizes, so they improved if their dad was in a coach's group, but none of those reached significance. This was a low-powered study. But there was some small evidence of generalization. And so I should also mention people really liked the program. 100% of the dads said they were satisfied. But we were interested also in engagement and treatment. So we did another study. And I'm going to skip through. These, again, are children with ADHD and their dads. We had 2 parent training approaches in this study. So this is different. This wasn't looking at efficacy. This was a comparative study looking at our coaches program relative to a traditional classroom-based approach. The major difference in the program is that for the second hour, the dads in the coaches program went out and did the soccer activity with the kids, okay? Fathers in the traditional program did not interact with the kids. They stayed and role-played with one another these strategies, but there were no father-child interactions. Here's an example of the dads on the field with their kids. Other kids were playing board games or arts and crafts. Let me skip forward to the results. So if we ask fathers at the end of the intervention whether the kid improved or not, people in the coaches program, the BPG is the coaches program, that was a significant effect. They rated their children as more improved in their behavior. We're also interested more, though, in engagement. So if we looked at attendance, fathers in the coaches program attended 80% of the sessions as opposed to about 65% of the sessions. So to the extent that that session was time out or giving good instructions or using planned ignoring, the fathers in the coaches program got about 1.5 more of those. We also are interested in on-time attendance. So we don't want our treatments to be like chemistry class in high school where you show up late and you leave early, right? We want them to be things that people are engaged in and want to attend. Fathers in the coaches program were more likely to show up on time, and what happened was they would get a cup of coffee. They'd all show up early, and they'd have a cup of coffee and talk with one another and be ready to go. Child attendance was really impacted by the coaches program. So you can see half of the kids in the traditional program dropped out. Some of the dads continued to attend, but they didn't bring the kid anymore. If the dads attended coaches, though, the kid always came except in 1 or 2 cases. So if it's important to get the child into your treatment setting, these sorts of interventions bring the whole family in. Something that we found, well, I should be honest, almost nobody did their homework. So that's the first thing to take away from this graph, right? The dog ate it. However, there was a favorable effect for the coaches program. But when I look at this graph, I think about the fact that the dads in the coaches group all practiced their parenting, right? They went right out onto the soccer field and they tried it out and they did it for 8 weeks in a row. So in one way, you could say their homework was to practice the strategy. They all did it. In the other group, we can't guarantee that happened with their kids. So again, as a clinician, I like to see the parents try the things out so I can see how well they're implementing the program. We saw that each week within the context of the game. Dropout was much less in our coaches program relative to regular parent training. Child dropout was a very large effect. And fathers were, in general, more satisfied. So if we looked at we asked them about the process of the intervention, there is a significant difference in a preference for coaches. And there's a trend for their feelings about the outcome. So based on our initial work, we think about behavioral parent training is an effective intervention for fathers. I think we were able to replicate the broader findings in the field that when dads do participate in parent training programs, they do better. Our thinking, as we've been doing this kind of work, is that we need to think about different models of intervention for fathers and maybe by extension for families. So if anybody's read the recent paper by Kasdan and Blaze that talked about changing our interventions in clinical settings to have greater reach, this might be one way to think about it. It's very hard to say that there's a behavioral parent training program doing using an evidence-based approach in every community across America. However, 35 million American youth engage in sports every year. So if we want to think about reaching families who may need these interventions, youth sports settings or recreational settings like this may be useful venues for offering the supports and skills that we have in our work. you.